It looks great.
Okay. Hi, everybody. Thanks for joining. It's a pleasure to be here with everyone on Earth Day and the 50th anniversary of Earth Day. I'm going to spend a little bit of time talking about some work that we've been doing at the New School to examine the current impacts of COVID-19, especially in the US and New York, and what are some of the questions that we might want to be considering as we move into as the crisis continues to evolve, and as it evolves in the context of changing weather systems and potential risks that we need to consider from other kinds of climate-driven extreme events. So that's why we kind of call this COVID-19 and climate. The basic questions that we're really trying to dig into is whether or not there are some basic policies that are flowing from the way in which we're dealing with the COVID crisis that we need to be considering when we start to think about multi-hazard risks. So I'm just going to introduce a little bit of the work we've been doing in the Urban Systems Lab here at the New School and talk to you about a couple of those components. One thing I wanted to highlight first is some work that we think is really relevant to this. This is a book that actually came out about 1.5 years ago called The Urban Planet. And it's free to download. It's been downloaded over 100,000 times. And so that's partly because of just the diversity of voices that are all discussing how can we make our cities more sustainable and more resilient. And even though this was before the COVID crisis happened, I think if you're interested in this, you'll find a lot of really insightful things from economics to governance to the role of artists and designers and planners, all trying to think about how we make our cities more livable spaces. So I just wanted to do kind of a quick plug for that. And then coming back to what we've been working on in the lab, in the Urban Systems Lab here, we've been asking a few questions. First of all, is this an urban pandemic? And if it is, and if there's starting to be signals of that, what should we be thinking about in terms of the way in which we design and plan our cities so that they can be more resilient to these kinds of emerging problems, and in this case, not just a problem, but a dramatic crisis that we're all kind of dealing with. Secondly, we've been asking this question, how can our work on looking at vulnerability and risk to climate change inform the way we understand vulnerability and risk to COVID? Is there an overlap, just first of all? And if so, what can we learn from that? Next, what I want to talk about a little bit is, as we start to deal with the COVID crisis in multiple ways, including emergency response, but also policies that have been put into place for social distancing and shelter in place, things we're experiencing really strongly in New York and in the US, but also in lots of other parts of the world. How is that affecting urban life? And how did that effect on urban life change the way in which we may have ability to respond or not to other kinds of risks, such as risks from extreme weather, like drought, fires, extreme heat, and flooding, extreme rainfall and coastal storms, all of these kinds of things that we've been working on and worrying about for quite some time in terms of the risk to climate-driven extreme events. There's an additional layer of complexity here, which is not just the overlap of risks, but the way in which we may see interdependent or compound risks, something we sometimes call cascading risk in climate science. So I will get to that towards the end, and that's kind of the question I want to leave us all with is, where do we need to go from here in terms of protecting our most vulnerable communities in the context of changing weather and climate systems? So to zero in on a case study of in the US and a case study in the New York, we started by sort of trying to understand the urban nature of this pandemic. And just on this question, is this an urban pandemic? Frankly, the science isn't clear yet. You know, we're still in the middle of this, so it's a little early to say that we know exactly what's happening and why it's happening. But there are clear signals of where the location of the pandemic emerged, some of the animal to human transmission that's driven by this, which I'm happy to talk a little bit more about. But one of the things that seems really clear, both from genetic analysis and human mobility analysis, is that the pandemic has been following largely airline transmission pathways. And through this spread, mostly through airline activity, we see that it's both coming from and landing in urban centers. And if you think about where airports are pretty much all around the world, they're very much associated with urban centers, and the demand for that use is coming from cities. So there seems to be a very strong urban footprint. You can see this in the genetic spread of the way in which there's slight differences in the actual cases as they're studying them, and you can use that to actually show transmission pathways. And similarly, we're seeing a very strong urban footprint there. This is important. The reason we even asked this question is because, and that's why I put up this book, Urban Planet, is because one of the things that we've been articulating and working on within the lab at the New School is this fundamental hypothesis that we are living in an urban century, and that we've fundamentally changed the nature of human environment interactions on the planet such that we have urbanized in a dramatic way, and that almost all major drivers in terms of global environmental changes, like the changes that are driving things like this pandemic, have been driven by urban change. So this is an important question, I think, in terms of how do we plan and design and manage our cities so that they can be resilient to these pandemics, and why we started with this question of how can we learn from what we've been studying in terms of responses to climate change as a way to learn how to respond to this. In the United States, I'll just kind of bring it to where we've been working we're in a pretty rough situation in terms of cases and deaths. On the other hand, social distancing and shelter-in-place policies are showing a turn now in terms of new reported cases per day. And in that sense, I think there's some really positive news of the last couple of days of how the virus is, on the whole, is starting to look. But one thing we've noticed, and this is from colleagues at NYU, is that back on this question of the urbanness, about 80% of all the variation in the spread of coronavirus across the United States is explained by three main variables: the size of your population, the density of the population, and the airline connectivity. All three of which you can pretty easily answer are driven by cities: the size and density and the connectivity of those. And so in that sense, it seems like a way of thinking about solutions and a way of understanding where to target resources and problems is going to have a lot to do with the urbanness of this pandemic. So let's drill down a little bit here to New York City. One of the questions we started with now back in early March, so for some people, this was still asking questions about whether we should be doing social distancing, whether this was something we should actually be worrying about. It was March 10th was when I went into quarantine, and March 11th when I finally convinced my family that this was actually serious. It wasn't that long after when New School started to take some serious decisions about this as well. But from the beginning within the lab, we've been asking this question: can our work on social vulnerability to climate change predict where we're going to see some of the most direct health impacts of COVID? And so we've started putting out some of this work, and I'm just going to show you some of the results of this. Here, as of Monday, this is data as of Monday from the Department of Health in New York City. We see basically a map of where the most cases are. This is the darker color is where you see the positive cases of COVID in New York City. And I want to highlight two areas here: the South Bronx and this parts around Flushing and generally around the Flushing area of Queens. And I'm going to show you why for a couple of reasons. One, you can see, I think obviously from this map, is they're darker, right? This is areas where we have many more cases. But I'm going to show you a couple other reasons why we're focusing on that. Thinking about who may be most vulnerable. Here, if you look at some of the information about who has access to health insurance, broadly across New York City, about 7% of the New York population doesn't have health insurance. But if you look at this in terms of those who are not US citizens, that rises to about 22% of that population. And clearly there's spatial variation if you look at the map on the right? Some areas have more uninsured than others. But these two areas in the South Bronx and Queens are places where we see more of a hot zone of uninsured. And on the left, I'm gonna walk you through this figure for a minute because I'm gonna show you a couple more just like it. On the bottom horizontal axis is the percent of the population. And on the vertical axis is the percent of positive COVID cases in New York as of Monday. And what you can see is that there's a clear trend that as a portion of the city has more uninsured, they have more positive cases. So the sort of title here is that we're definitely seeing a trend in terms of the uninsured, and it helps us think about where we should be targeting resources. You see an even stronger trend. You see the error bars around that trend line on the left are very small, because this is a much clearer pattern in terms of the fact that communities of color are most affected. And on the right, I'm highlighting again these same areas. The South Bronx and these parts of Queens are not the only places where you have this pattern, but they are certainly a place where we're seeing an overlap of multiple patterns in terms of communities of color really bearing the brunt of COVID cases. And in parts of Queens, for example, the likelihood of dying from COVID is twice as high as some other parts of the city. So this is, on the one hand, a serious concern. On the other hand, shouldn't actually be very surprising, not just given headlines you may have read that are based on less data or anecdotes, but nonetheless reinforcing the understanding that we've had for a very long time that structural inequity is behind these kinds of exposures. And what I'm trying to highlight today is that it's not only true for the ways in which we've been looking at who's most vulnerable to heat or to flooding or to other kinds of environmental challenges that are essentially environmental injustices, but that COVID is now a new environmental injustice that we're witnessing firsthand here in New York City. If we look at it from an economic perspective, this figure is showing the lines going the opposite direction, because as you move to the left of the figure, you're at the lowest income in the city, those that are below the poverty line, and you see that they have a much, much higher rate of being positive for COVID. And if you look in the map, you see these hotspots again in areas of the South Bronx, Northern Manhattan and Harlem, and parts of Queens, where you see the lightest colors are the areas with the least amount of resources in terms of economic resources. That when we first started looking at this, we sort of hypothesized that this could be a way of predicting where we might see the most cases, and not because there's prior medical conditions, not because some of the things that we might think about in terms of epidemic spread and the way this epidemic actually works as a virus, but actually because of the way in which the structure of the city, the way we've planned and designed this for decades, has concentrated the kind of vulnerable populations in a way that we're seeing it play out with COVID too. You see this also if you look at it in terms of that smaller section of the income and poverty line. But I'm just going to move on because I think the points are being somewhat clear here. I just put in some of the visualization of this kind of data that we've been doing in the Urban Systems Lab. If you zoom in to the South Bronx, you can see here in light, the light colors are the lowest income areas, and you see large apartment buildings that have thousands of people in them that are in this vulnerable and high likelihood of being directly impacted from the health impacts of COVID. And then we haven't even started to deep talk about the economic impacts yet. My point here is that it's not simply a story about elderly, which is a huge part of this, and I can talk about that some more. It's not simply a part of people who are for prior medical conditions predisposed, but it's actually the history of racial injustice and structural inequities in the city that is driving the patterns that we're seeing in terms of who's most affected. But I'm also talking about this because I want to talk about the interdependent risks of climate change as well. So let's get to that next level of questions. How is our policies that we put in place to flatten the curve impacting our life? So one of the things, as I mentioned, the sort of positive signals here is the social distancing and shelter-in-place orders are having an impact. In the US broadly, we have a whole list of these kinds of policies, from school bans, school closures, bans on large gatherings, mandatory quarantine for travelings, state of emergency declarations that have been able to deploy resources that have been really important for emergency response. These kinds of policies are showing positive impacts, and yet at the same time, they have implications. So I'm going to just show you a couple of these implications. One of them is we've been looking at social media data, Twitter in particular, and this is just to sort of corroborate, are we seeing the evidence that social distancing is actually happening, that people are actually staying in place. And if you look on the left side, over 60% of all of this social media activity, at least in terms of Twitter activity, which of course is just a small slice of human behavior, but over 60% of that is happening in residential areas. So there does seem to be a signal that's kind of clear that people are staying home and staying home a lot. The other interesting one, and we're doing some further work to kind of investigate this, so I'm not going to talk about it much, but is the importance of green and open space, of parks and open space in the city. And I think this calls into question a lot of the way in which we've focused on sustainable city agendas as densification and optimized and efficient, and yet often squeezed out nature, which now for both mental and physical health is, I think, should be seen as a part of our critical infrastructure. So there's, I think, a whole discussion there. In terms of other human behavior, New York City subway use is down 95%. We're seeing similar kinds of decreases in transit use and human mobility across the United States and lots of other cities around the world. This is a really dramatic increase or decrease that I think is still interesting to see the patterns in the lower right here in terms of the weekly weekend activity. But in the gray bars, you can see when the shelter in place order went into effect, the sort of increase of cases as it moves up to the right, and this leveling off at very low levels of this kinds of transit use. If we look at it from the way in which shifted, this is data in terms of the electric load in the New York City area, and we're seeing record lows. And that's because of the decrease of industrial, commercial activity, lots of other retail and other kinds of activity that have high energy demands. And so now we have this interesting result that we're not using very much energy. And this is all sort of evidence of this massive behavior shift that's happened in response to policy, right? So we have COVID, we have policy, and we have change. Now I want to ask the question of what does this change potentially mean when we start to think about not just COVID, but other kinds of challenges we may need to be prepared for. What are the overlapping risks between COVID and extreme weather events and other things driven by climate and climate change? Last week, for those in the US, there's lots of other stories around the world just in the last couple weeks, but I'll just mention some here. On April 12th, we had tornadoes devastate multiple towns in the US Southeast. The same weather system caused high winds, local flooding, and power outages in the New York City metro area. In the southeast of the US, we've had temperatures well above average. One of my colleagues who I was conversing with in Hyderabad, India, their temperatures were over 40 degrees Celsius, which is above about 105 degrees Fahrenheit. It's only April. So this is of concern, especially given the temperature trends we've been seeing for multiple years, and that last year was the second warmest year on record. So these are some concerns, and not only in terms of some general concern, but if we look here again in the US Southeast, Florida's been enduring record high temperatures for April, much higher than the last couple years in terms of what they're experiencing in terms of heat. So there's a pretty serious question about what a shelter-in-place policy that has people stay in their homes means for those who are most vulnerable, those that have the least amount of resources, those that may not have access to air conditioning, or other policies we might have in place to deal with a heat wave when and if it comes. And it's not only heat waves, but I want to focus on this for a couple minutes. In the region, in the Gulf region, we also see that it's not just temperature per se, but the temperature of the sea surface. Now, for those of you who are familiar with some of the things that drive hurricane formation, this is a concern because we're just a couple weeks from the official start of hurricane season, and that's just not hurricane season in the Caribbean and Atlantic area, but this is typhoon season around the world. So if you look globally at where most urban populations and human populations are, this shift in seasons that we're about to experience presents a serious potential challenge of multiple kinds of extreme events that cities, that communities, that neighborhoods may be facing as they're facing dealing with the COVID crisis and potentially even shelter-in-place type policies. we've looked at this for a long time. This is something, the reason that we've turned our attention to COVID is because we've been spending a lot of effort over the last years trying to understand various kinds of climate risk. Here's an example back in New York, in East Harlem, where we've been looking at some of the areas that are most at risk from heat. And again, I'm highlighting some areas of the city that we see these persistent and overlapping challenges that are dealing with COVID at the same time. These are also, see the circle around northern Manhattan and the South Bronx here too. These are areas that have other kinds of challenges, like the hotspots for places where people have the least amount of air conditioning. And so if you think about how, what are our strategies, like cooling strategies to deal with, for example, extreme heat, these are places that we need to be concerned about and think about what our strategies are going to be if we face heat waves, and I'm just talking about New York for a moment, but I think this applies to many other cities, if we have these kinds of policies designed to reduce the transmission of coronavirus, but because of the policy itself, it may create additional risk, or even what we might call an interdependent risk, a risk to a climate-driven extreme event that's driven by a policy that's designed to help us reduce our risk to COVID. We've done some modeling. Luis Ortiz is a climate modeler in our lab who's looked at how much indoor heat exposure and how many hours of indoor heat exposure you might have under different scenarios. And you can see this is also not evenly spread around the city. And this has a couple implications. One is the direct impacts of high heat. Indoor areas are areas where the heat doesn't tend to go down. If you're in an area that's, if you're in a building, if you're in an apartment that isn't air conditioned, that heat will persist long into the night. And so from a physiological standpoint, if your body isn't able to cool down essentially on a 12 and 24-hour cycle, this is where we see the most impacts of heat-related morbidity and mortality is indoors. So this is another issue that we've been looking at, is trying to understand that. A secondary issue is if you don't have air conditioning, or even if you have air conditioning, these number of hours are significant because you may need to triple your use of air conditioning to deal with these extended hours indoors as it gets warmer in different situations. So this becomes an economic cost that we're need to figure out how to deal with as we move into warmer weather. It's not just heat. I'm going to kind of wind this up a bit so we can have a discussion. But you know, our work has been looking at coastal flooding, extreme rainfall scenarios, trying to understand, and working with New York City really closely on this in the city, but also in 8 other cities in the United States and the Latin American areas. And what we find is, again, that here in East Harlem, coastal areas of the South Bronx, just looking at coastal flooding, we see communities that are being impacted by COVID, that are being impacted by heat, that are being impacted by coastal flooding. And so again, this overlapping risk extends into other kinds of risks, which really brings me to a bit of a final point, which is for, I think, at a general public level, we have to start recognizing that we live in a different world, that we live in a world where we're facing multiple hazards, and some of these hazards may occur simultaneously. In the New York context, I think sometimes people forget that when Hurricane Sandy struck, that we had a cold front move in right afterwards. And so while we had widespread power outages, homes had no heat, and people were literally cold during the aftermath of a hurricane. It's not that unusual. This has happened in the past, and now sort of suggesting that we need to do some serious thinking about how we can adapt our policies and make them more flexible, and even think of new strategies to deal with multi-hazard risk. I'll just mention one example back on heat. At least in the global north, and especially across the US, one of our strategies for dealing with heat beyond air conditioning in homes and apartments is cooling centers, is creating places where we have an alternative if people don't have air conditioning to go to an air-conditioned place so that their bodies can cool down and recover, and we can reduce the health impacts of heat risk. But in the context of COVID, packing a lot of people into an area to keep them cool is exactly the wrong idea, right? So these are, again, some underlining of the ways in which we kind of need to rethink and think differently in a world that's facing multi-hazard risk. And so these are the kinds of interdependent risks and a bit of the discussion I was hoping to have with everyone here today. And I'll just stop there and I think open it up. And I just want to thank a bunch of the designers, scientists of all kinds, social scientists, biophysical scientists, and data scientists who have been working on this with us in the Urban Systems Lab, and some of our funders. And if you want to see some more of our work, you can check it out online at the link.
Okay, so send us your questions. Right now we've got